Joining us now is Dr. Robert Murphy. He is a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning, Larry.
On boosters, they say there's an age cutoff, right? And then it says others who have some kind of some other kind of health condition. What constitutes those health conditions, and do you have to prove it?
You don't have to prove it. You just have to attest to it. You have to sign a statement that says you have one of those conditions. They're listed on a variety of websites. It's basically anybody with an underlying chronic disease. And it's pretty loose what it is. Now, the pharmacists, some of them are asking very detailed questions. They're not supposed to really be doing that. They're just supposed to make sure you're eligible and you sign the attestation statement, and then you can take the booster. Ultimately, the age limit for getting the booster is going to go down.
Let's talk about this Delta Plus variant. The Delta it just spread like wildfire. This one they're not as concerned about. Why?
No. The Delta Plus one is a concern. And, the virus just keeps mutating. So we have Delta. In the United Kingdom, they have Delta plus 2 more mutations. It's worse. And that's why they're having this huge uptick there. And now it's spread to continental Europe as well.
What are some countries doing that is working, and what are some things that are not working? And maybe some of those things work here, maybe they don't. Maybe you could talk about that.
Well, what's working is promoting vaccines to as many people that are eligible. That is the thing that is going to basically save us. That on top of mitigations, like wearing a mask when you're in a public place, and staying at least 3 feet away from other people, social distancing, when you're having a lot of outbreaks, when you're having a high level of outbreaks, like many of the places in the United States are. It's pretty simple. Every time that goes into effect, the cases go down. I don't know what's so hard about that, but the vaccine strategy is really the key.
Just to be clear about this Delta Plus variant, though, the FDA, former head of the FDA, Scott Gottlieb, says we should see cases still drop as we approach Thanksgiving because this variant might not be contagious enough to worsen the pandemic. So people still need to worry about it, though?
Well, you have to worry about it if it's there.
Okay.
So in the United Kingdom, on September 27th, they noticed the first case. And as of last Friday, just a couple days ago, it was up to 6%. 6% in less than 1 month. That's a huge rise. So, whether that's going to jump over here, it remains to be seen.
I see.
All right, let's get to viewer questions. My husband got the J&J vaccine and would like to get the Moderna booster. Will they give him a full dose or half dose? Can he request a full dose?
Yeah, no, this brings up some good questions. First of all, everybody that got the J&J vaccine is eligible for a booster, all 15 million people in the United States. You don't have to have any underlying disease or anything, and you can get a booster. You can get the J&J booster, you can get Pfizer, or you can get Moderna. The Moderna boosters are being given at half the dose, 50 micrograms, and that's because it works. It works just as good. With vaccines, giving more doesn't necessarily make it work any better at all.
All right, this person says, should we plan on another COVID booster after 6 months following the first booster?
Well, this is a really good question. Nobody knows. We'll find out in 6 months. We'll see what happens with the infection rate, hospitalization rate, and death rate over time. So, we don't know. We may not need a booster for a year or two or ever. It really is completely unknown.
All right, here's another one. I'm allergic to shellfish, so my doctor recommended the J&J vaccine. Can I get a Moderna booster since it's more effective?
Well, a couple things in this question. When these vaccines came out, we were having reports of anaphylaxis, and then nobody died of the anaphylaxis. We don't hear about it too much because it's very rare. But having a shellfish allergy does not mean you have to take the Johnson & Johnson vaccine. You can actually take any of the vaccines. So that's one thing. If the booster effect giving the Moderna after the J&J is pretty phenomenal. The antibodies increase 76 times. And that's at the half dose. So you only need the half dose. You don't need the full dose.
All right. If you didn't get your question answered by Dr. Murphy, he answers them bi-weekly on Northwestern University's Institute for Global Health Facebook page. You can also submit questions via email or head to our Morning News Facebook page and post one there. We'll talk to him again on Friday. Thanks, Doctor.
Great. See you Friday.
All righty.
Thanks,
hey, Paul.
Doctor.